everyone to think about how they may contribute to the process of reconciliation. So we do have a few regrets, Jamie Lowry and Dave Wolf, that I'm aware of. And I believe Jamie McGarvey will be joining us shortly. So moving on to approval of the agenda, were there any additional items that were to be added? Not that I'm aware of. So hearing none, I'm looking for someone to move for the approval of the agenda. Just tell me your name.
Karen Cook.
I'll move. Yeah, okay.
Karen Cook. Okay, and a seconder?
I'm happy to second, Marianne. It's Gary.
Gary Gunther. Okay. Be it resolved that the Finance and Property Committee agenda dated February 22nd, 2023 be approved. And I'll call for a recorded vote. Karen Cook?
Yes.
Rick Champagne?
Yes.
Blair Flowers?
Yes.
Gary Gunther?
Yes.
Sarah Inch?
She's not with us.
None. We'll move on to 4.0, which is a presentation of the audit planning report for the year ending December 31st, 2022. And I welcome Derek D'Angelo from KPMG. The floor is yours.
Thank you. Good evening, everyone. The report, is it, do you have printed copies, or how did you want to go? Yeah, you have printed copies? Okay. So I'll just refer to the pages as I'm going through, and hopefully you can follow along with me from it. So I'm going to turn into basically the first page that talks about audit quality, which is just after the table of contents. So one of the first things I want to talk about is how at KPMG we always strive to do the right thing, and quality remains our highest priority. And on the graph, it kind of just talks about the different things that we do as part of the audit. And one of the things that, when we define audit quality is, being that the outcome is being defined as that the audits are executed consistently in line with requirements and the applicable professional standards with a strong system of internal controls. And we do this with the level of objectivity, independence, ethics, and integrity. So when we look at the chart, the graph on the right-hand side, again, we talk about things like being independent, assessing risks to quality, applying the appropriate levels of expertise and knowledge to the engagements. And the whole thing relates to basically a consistent monitoring and remediating of any issues that we find as part of the engagement. And that really resides with me as the audit partner on the engagement. That's my overall responsibility, besides delivering the final product to the Board of Health, is to make sure that the engagement is performed at a high quality. If there's any questions, please don't hesitate just to stop me along the way. I don't mind answering them as we go, or you can just ask me at the end, whatever's most convenient for you. So looking again, just turning the page to the highlights, looking at the scope of the audit, we go through when we're talking about the audit and we look at things that are significant risks. There are certain risks that we can rebut, and we also look at things like required communications and any future pronouncements for the audit. And we'll also talk about how materiality in the audit engagement is calculated and talking about the audit risks. So looking at the significant risks, one of the significant risks is that there's a presumed fraud risk related to the management override of controls. This is a risk built a bit is CAS 315. This is a new standard that's applicable for any audits that begin on or after December 14th, 2021. So that means it is applicable for this year end. And I'm going to just, I'll save it for Appendix 2 because there's a detailed slide on CAS 315, but it will impact the way the audit is done and the level of audit work that we need to do in certain areas. And the future pronouncements, again, I'll talk about this a little bit later, but one of the future pronouncements that will be impactful in fiscal 2023 is the new standard with regards to asset retirement obligations. So I'll have a brief talk about that a little bit later. So materiality in the context of the audit is really what we do is we determine materiality at the beginning of the audit. And what this does is this basically allows us to determine what level of audit evidence we need to obtain, and basically determines what audit procedures will perform on certain areas. We use our professional judgment in determining that materiality calculation, as it's based both on quantitative and qualitative factors. And one of the things we do is we reassess materiality throughout the audit, and at the end we'll revise materiality if required if certain things are determined to be that will impact our materiality level. So again, we use it right at the beginning to plan and perform our audit procedures, and that determines the nature, timing of those procedures. We use it to determine the level of risk. And again, we'll identify that and modify it at the end of the audit or during the audit if need be. And again, that also determines our level of reporting on misstatements, and that's directly tied to the level of materiality. So looking at the 7th page in, which is the materiality calculation with the graph. So last year, materiality was set at $641,000. This year, it's set at $678,000, and there are various benchmarks that are used to calculate that can be used to calculate materiality. So in a not-for-profit organization, two of the main standards that are used are total revenues and total expenses. And what we do is we make sure that when we're selecting a measure, we do comparison to the other benchmarks to make sure that one of those measures is not completely out of line. Sometimes a total asset measure could be completely out of line with what a benchmark for revenue or expenses would be, and therefore we would just discount it. So looking here, expenses, as you can see, are around 3%. We can select anywhere between 1% and 3% of the total expenses or total revenues to be our materiality percentage. And then we basically it's a purely math calculation to take 3% times the total revenues or total expenses to get your materiality for the year. So as you can see that in 2020, total revenues were $20.9 million. 2021, the adjusted total revenues were $21.9 million. And what we've done here is we pulled out certain one-time funding. So we want consistent, repeatable revenues, not specifically one-time revenues when we're basing our calculations on. So we've pulled out certain one-time items from our materiality calculation, which actually reduces your materiality, which means we're looking for a higher precision as part of the audit. I think total revenues without pulling this was around $26.5 million. So there's around almost $4.5 million pulled out of that calculation, which reduces materiality. Total expenses, same thing. Last year was around $22.6 million, pulling out those one-time costs. And in this situation, total assets is actually quite comparable at $23.4 million. So we'll be using our benchmark this year as expenses. And you can see that if we were to pick revenues or assets, we would be at a consistent materiality basis, and it's only slightly higher than last year's materiality. Again, some of our other risk assessments, again, I talked a little bit about this. So there are certain risks that we look at, one being the risk of fraud, one being the risk of error, and we look at it from some various kind of like your main main process streams. So I talked about the management override of controls, and then we talked about you have tangible capital assets, all your fixed assets, buildings, furniture, anything large like that, computers. Then we look at the revenue side, and you're funded by a lot of government grants. So that is, again, a potential for risk of error with regards to timing of grants and recognition of grants. We'll also look at payroll being, the most significant individual expense that the health unit would have, and then looking at the financial reporting to ensure that everything that's being reported in the financial statements is supported. So again, looking at the significant risks with the management override of controls. Why this is a non-rebuttable risk is it's that because management is in a unique position because they have the potential to manipulate accounting records and potentially prepare fraudulent financial statements because they know where the overriding controls are. So they know how to get around any potential controls to make sure that they appear to be operating effectively. So again, this varies from entity to entity. You can't just use a blanket that's the way it is, but it is a potential risk that's present in all entities, and that's why it's a non-rebuttable risk. So what do we do to deal with this as part of our audit approach? We do things like testing of journal entries because that's one easy way for management to make adjustments to financial statements is by making journal entries. So we will look at material journal entries that are recorded throughout the year on a test basis to ensure that there's valid support for those journal entries. Also, management has input into any estimates that are in the financial statements. So again, what we'll do is not only looking at how estimates are calculated in the current year, but we'll also we'll do a retrospective review of estimates. So in 22, we'll actually look at estimates that were in the 2021 financial statements and just see if they were accurate based on management's analysis of those estimates. So, something simple and not necessarily specific to the health unit would be that, say for an allowance for a doubtful account. If there's a receivable that that management deemed that they might not collect, they would book an allowance against it. Well, now we'll look at in 22, we'll look to say, okay, how close was management's estimate to that to actual, and did the estimate they book, was it valid? So again, we'll look back to see if there's any significant estimates that were present in the 2021 statements and just make sure that management's process for developing those estimates was reasonable. And then the last thing we'll do is that we'll look at any significant unusual transactions and just make sure there's an appropriate business rationale for those transactions. So these are kind of the standard procedures that we would do when addressing this significant risk. So again, as I mentioned, the other areas of focus, just to give you a sense on what some of the procedures that we'll do and how the audit approach is. So this is on page 10, titled "The Other Areas of Focus." So as mentioned, your tangible capital assets, that's one of the areas, and we'll look at the classification between tangible capital assets and make sure that if something's operating, it's recorded as operating. If something's a capital item, it's recorded as capital. So what we'll do is we'll vouch significant additions to the actual invoice. If there's any disposals, we'll look at supporting documentation to support the disposal and make sure it's recorded correctly in the records. We'll review repairs and maintenance expenses to ensure that they're properly accounted for. We'll review the existence of a capital asset schedule with the inventory and make sure that it's being appropriately maintained by management. We'll perform analytical audit procedures over the adequacy of the amortization of tangible capital assets, and we'll inquire of management if there's any impairment to the tangible capital assets. For government funding, what we're looking for here is basically ensuring that there's completeness of the grant revenue that's recorded, which again encompasses any of the related receivables and potentially deferred revenues, to make sure that revenues are being accurately recorded and the timing is appropriate. So again, here we're going to look at year-end reconciliation of grant balances, obtain supporting documentation for any of the significant reconciling items. We'll actually look at contracts to make sure that everything's being recorded in accordance with the contracts. And again, we'll perform analytical procedures over the revenues and look at any potential repayables, receivables, or deferrals based on the contracts. And again, we'll perform substantive tests if needed. We'll perform substantive tests to address any eligibility of costs that have been incurred to ensure that they're being appropriately recorded and the revenues are being recorded to match against those. Payroll expenses, which includes the related accruals related to payroll. Again, we're looking at the completeness, existence, and accuracy of payroll expenses. And again, we're going to test and evaluate the design and operating effectiveness over the controls over payroll. We're going to perform substantive analytical procedures over salaries and benefits, including their related accruals. We'll recalculate any significant accruals and review collective agreements to ensure that there's completeness of liabilities if there are any related to retroactive pays and things like that. And looking at the financial reporting, again, we're going to make sure that there's appropriate, everything that's appropriately presented and that the disclosures are appropriate in the financial statements. And again, we'll, as the engagement partner and team, we will look at current public sector accounting standards and make sure that the standards are in accordance with the current disclosure requirements and industry practice as well. So looking at some of the key milestones and deliverables, this is on the 11th page in. So what we do in January, our team would have started the preliminary risk assessment activities in discussion with your staff. We would have then prepared and had the audit planning report ready. And again, it's February, we're delivering the report to the committee. Then we'll conduct our year-end audit field work in accordance with the timing that is determined with Isabel and her team. And then, and again, these are all estimates of timing. End of April, we'll do the closing meeting with management. We'll present our audit findings report to bring to you the results of the audit before the financial statements are approved, and then look for the board's approval of the financial statements. And then sometime after that, May, June, July, depending on timing and everybody's availability, we'll have a debrief with management to talk about things that worked, that didn't work. How can we as a group, both management and KPMG, improve the audit going forward and make sure that we're making the process as seamless as possible for everybody. So looking at the appendices, I'm going to look at, again, I talked about it quickly, but on Appendix 2, so this is on page 14. This is the new standard, which is basically CAS 315, Canadian Audit Standard 315, which is identifying and assessing the risks of material misstatements. And again, this whole standard has been revised, reorganized, and modernized in response to challenges that were in the previous standards. And what this does is it impacts, again, as any statement after December 15th, 2021. Now we're required to do a more detailed design and risk assessment procedure for the entity and its environment, the applicable financial reporting frameworks, the system of internal control. And then again, through that, we look at, how can potential material misstatements happen and what procedures are in place by management to minimize the impact of any potential for risks of material misstatement. So this Appendix 2 goes on for multiple pages. So I'm not going to go through everything in these slides because there's a lot of, just to be honest, a lot of accounting and audit speak. But it basically goes through all the changes and how this risk assessment and identification process will now work and how it impacts us as the audit team and how it impacts management. And really looking from the outside, what does it mean? It just means it's an enhanced level of what we always used to do. We always used to do this in a certain way. Now this has to be documented in a lot more detail than it ever did before. And again, this is a requirement from the CAS. This is not a KPMG requirement. This is a CAS requirement. So every entity that has an audit will have to deal with CAS 315. So again, I don't anticipate any real issues from management perspective. It's just this will require more documentation and more time just because it's a new standard and those are things that are out of our control as well as the auditors. We just have to make sure that they're followed. And again, it also involves looking at IT systems and documenting IT systems, which sometimes are not necessarily documented in their entirety, just because of sometimes the complexity of them. But again, that will have to be updated as well in 2022. And the last one, and really that's the last slide I really wanted to specifically talk about. Appendix 3 talks about lean and audit, which is a process mapping exercise that's available to management to basically look at streamlining processes, look where the pain points are in processes and how things can be done to improve them and to make things more efficient. That's not part of the standard audit process, but something that we can help management with on a go-forward basis. And then Appendix 4 just gives you a sense. If you they're all hyperlinked, you could actually click on them and it'll bring you to the various KPMG resources that talks about current developments, audit committees, audit and assurance insights, uncertain times, which is financial reporting when the economy and environment is troubled, and really looking at things like ESG, which is environmental, social, and governance, which is again another important part of how financial reporting is being measured going forward. So that's the audit planning report I have for today, and more than happy to try to answer any questions. And if I don't have an answer, I will make sure I get back to you.
Does anyone have any questions? No? Hearing none, I would like to thank you very much, Derek D'Angelo, for coming to present to the board, and look forward to the results of the audit. Lots of work ahead for our staff, we know that. So thank you very much.
You're very welcome, and thank you for giving me the opportunity to attend the meeting tonight. Appreciate that. Good night, everyone.
Good night. Okay, so moving on to 5.0, the approval of the previous minutes. I'm looking for someone to move the resolution.
We have
Rick?
Jamie McGarvey.
Oh, Jamie's there too? Okay, I saw Rick first. I'll put Rick Champagne for a mover and Jamie for a seconder, if that's okay. Okay, be it resolved that the minutes from the Finance and Property Committee meeting held on January the 25th, 2023 be approved as presented. Were there any errors or omissions? No, none noted. Then we'll proceed to recorded vote. Karen Cook?
Yes.
Rick Champagne?
Yes.
Claire Flowers?
Yes.
Gary Gunther?
Yes.
Sarah Inch?
Yes.
There yet? Oh, sorry. Thank you. Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Mary Ann Stickland, yes. Morris Switzer?
Yes.
Motion is carried. Moving on to 6.0, date of next meeting, April the 26th, 2023, time to be determined, and it'll be live streamed from 345 Oak Street, North Bay. More details to follow as we get closer to the date. So business arising from the minutes, none were identified in 7.0. Moving on to new business, 8.1, the one-time funding requests. Isabel Churcher had provided a briefing note for one-time funding requests for 2023. And it should be noted that these were not included in the Board of Health budget for 2023 that we approved on January the 25th, 23. So Isabel, take it away.
You have the briefing note there in your package. You'll note that there's 4 items that I'm requesting to ask for one-time funding for these items. I did refer to not getting the ministry package in this document, but it actually arrived late yesterday, and I had to look at it today, and there really is not really any other opportunities that were not included here. So the 4 that are here are a public health inspector practicum. This is to help with a summer student and in the busy summer inspection season. Needle exchange funding, and for both kinds of COVID funding. And I did give you more detail on what each one of these would be used for in the brief. I'll answer any questions there are.
Rick Champagne, you have your hand up?
Oh, sorry, my hand's down.
Okay. Are there any other questions? No, I don't see any. Your hand is still up, Rick, but that's okay.
Yeah, I'm trying to get.
That's okay. If there's no further questions, I do have a resolution to support this request, but I need someone to move it firstly. I'm looking for a mover and then a seconder. Rick Champagne will move. And do we have a seconder? Speak up.
Jamie here. I'll
Jamie?
second that.
Jamie
Jamie,
McGarvey will second. Okay, so the motion reads, whereas the North Bay Perry Sand District Health Unit's annual service plan must be submitted to the Ministry of Health by April 1st, 2023. Therefore, be it resolved that the Finance and Property Committee recommends to the Board of Health approve the submission of the following requests for one-time funding for 2023 to the Ministry of Health by April 1st, 2023. The first one is the Public Health Inspector Practicum for $13,500, Needle Exchange Program for $20,000, COVID-19 General Program for $185,000. Number 4 is COVID-19 Vaccine Program for $1,070 for a total of $1,288,500. Is there any further discussion? No, so we'll call for a recorded vote. Karen Cook,
Yes.
Rick Champagne,
Yes.
Blair Flowers,
Yes.
Gary Gunther,
Yes.
Sarah Inch,
Yes.
Jamie McGarvey,
Yes.
Jamie Restuel,
Yes.
Mary Ann Stickland, yes. Morris Switzer,
Yes.
motion is carried. Thank you for that, everyone. And thank you, Isabel, for putting all that forward. That's a good thing for us to be doing. So moving on to 8.2, the fourth quarter income statement, September 1st to December 31st, 2022. Isabel, will you speak to that as well?
Sure. This is the unaudited financial statement, basically very similar to what we submitted to the ministry for the fourth quarter report. It's done by Public Health Standards as the requirement is with the ministry. And so that's the state we were at the end of the year. I think I'll draw your attention more to the last page of it, where the COVID outbreak is, and then I can answer any questions people have. We we were funded as we have been over the last few years in two pockets for COVID, what they're calling outbreak management, and the second, which is for the vaccine rollout. You'll see that we track it under two different things, whether somebody's already previously worked at the health unit or the cost is something of the general budget, which is we're calling an internal transfer. And the second part is where we had to spend money that we normally would not have spent. And so the outbreak management, which is anything essentially that's extra requirements that we have due to COVID, might be PPE, it might be extra cleaning, it could be overtime, it could be a number of things. That amounted to $716,000 for last year. And the vaccine rollout cost just over $2.194 million. So the total COVID cost is close to $3 million for last year. And the requirement of the ministry is that shared funding, mandatory program funding must all be used first before they fund it at one time. So, so you'll see that the two numbers there come together to be a 1.3 million of mandatory program cost was used to fund COVID. And that leaves the province picking up 1.5 million at 100%. They did fund us for more than that, so there is money being returned because the money we received was 3.1 million. I'll answer any questions anybody has about the rest of it if there is any. Excuse me.
No one has a question? Even one little question? No?
It's too confusing to ask, I guess.
It'll all fall into place. Okay, well,
this format, just so that everyone's aware, this format we do on a quarterly basis. You'll get a reporting like this each quarter during the year.
yes, thank you, Isabel. And also, could you speak to 8.3, the fourth quarter medical officers' health expenses, September 1st to December 31st, 2022?
This is the same thing. This is in a part of our transparency mission here is to show you what Dr. Chirico spends on any of his expenses. You'll see that he's not a big spender. There's not a huge amount here, but this you'll also get this once a quarter. And if you have any questions, Dr. Chirico will be happy to answer them for you.
Does anyone have any questions?
Such a big budget. I don't know if I should talk about it.
Did you have a question, Rick?
No, I'm just making a
No,
remark
just-
that
He's giving me a hard time.
it's very
Okay,
Don't give
are
him
there-
much to go far with.
Yeah. Does anyone
They don't
else have a
talk.
question? Just speak up if you do. No, hearing none. Thank you very much, Isabel, for the updates and best wishes for the audit. I know it's a lot of work for staff over a big period of time with all the other things that are going on. So thank you very much.
Okay, thank you. Good night.
Good night.
Thanks, Isabel.
Okay. So moving on to 9.0 in camera, there was none that was indicated. And so are there any further comments or questions before we adjourn from anyone? No? Okay, well, thank you, team. We hereby adjourn the Finance and Property Committee meeting at 5:36 and turn it over to our board chair, Rick Champagne.
Thanks so much, Marianne.
Thank you, Mary Ann. Great job. And thank you for everybody for coming out tonight. So we'll call the meeting to order. First thing on the agenda is approval of the agenda. I need a mover and a seconder. Moved by Mary Ann. Second by
Karen Cook.
Karen Cook. Thank you. All right, so we're going to have a vote, a recorded vote. So we'll start with Karen Cook.
Yes.
Thank you. Rick Champagne, yes. Blair Flowers,
Yes.
Gary Gunther,
Yes.
Sarah Inch,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Mary Strickland,
Yes.
Morris Switzer.
Yes.
Any amendments? Nope. And then carried. Next on the agenda is a presentation from the Nutritious Food Basket 2022. I guess we're going to listen from Aaron Reese first, I believe.
Yes.
I'm just making sure they
Are on.
made it on. Mm-hmm. Yep.
And
Hi.
also, I forgot, we got regrets also from Jamie Larry and Dave Wolf this evening. There you go, Aaron. Thank you.
Hi, everyone. So I'll go ahead and share my screen if that's okay, Sherry. Oh, sorry, just not sure why that's. Oh, there we go. Okay. Okay, so can everybody hear me and see my presentation okay?
Yes.
Yes.
Perfect. Thank you so much. So I'm so excited to be here. My name's Erin Reese. I'm a public health dietitian with the Healthy Living team, and I will share my manager, Chris Bose, is here with us as well. And we're really thankful for the opportunity to speak to you today about some of the work that our team's involved with, specifically our key messaging from the 2022 Cost of Eating Well report. So in my brief presentation this evening, I'm going to provide some background information about food insecurity, discuss what our health unit contributes to what is known about this issue in Ontario, and how we monitor food affordability, as well as why we need to be calling on governments for income-based solutions to address this important issue. So when I say food insecurity in this context, I mean inadequate or insecure access to food due to financial constraints, or very specifically, not having enough money to buy food. The spectrum of how food insecurity is measured includes a range from being worried about running out of food, to the quality of food being compromised in your diet, to actually having to skip meals and go without food, all due to lack of income, again, within the context of this definition. This graph shows how tightly tied income is to food insecurity, that the lower the income of a household, the more likely the household is to report experiencing some level of food insecurity. Now, it's important to note here too that there's no evidence currently to support the notion that food insecurity is a result of poor budgeting or mismanagement of money or a lack of ability to meal plan or shop healthy on a budget. The bottom line is that when income is too low, there just isn't enough money for all the costs of living, including food. Food insecurity is a serious public health problem for two primary reasons. Number one is the magnitude of the problem, which is shocking, with most recent estimates showing that about 1 in 6 households in Ontario experience food insecurity, and that 1 in 5 children live in a food insecure household in Ontario. And number two, the magnitude of the problem is very concerning because of how serious the health consequences are associated with experiencing food insecurity. So the association between experiencing food insecurity and many, many different chronic health conditions is continually emerging from the academic literature. And it extends way beyond the obvious diet-related chronic conditions that may come to mind when you think about somebody who might be experiencing food insecurity, such as diabetes, high blood pressure, cardiovascular disease. There's also great mental health consequences associated with experiencing food insecurity, so depression, anxiety, and other mood disorders. And there's more to the picture when considering other healthcare related complexities. So adults living in food insecure households are more likely to have difficulty managing their chronic conditions, not take their prescription medications as prescribed due to cost. They have higher healthcare usage, which increases with the severity of food insecurity, and they even have a shorter life expectancy. So again, the severity of the health consequences of food insecurity paired with the magnitude of the problem make this a serious public health issue that we need to be taking effective action on. So how is our health unit contributing to what is known about food insecurity in Ontario? Health units across the province monitor food costs at the local level using the Nutritious Food Basket Survey. It's a tool provided to us by Health Canada that's based on Canada's Food Guide. Locally, we visit 12 grocery stores across the district, including stores in urban and rural areas, stores from each of the various grocery store chains, including regular and discount stores, and we use both online and in-store costing to come up with a representative cost of eating according to Canada's Food Guide. Most nutritious food basket items are whole, unprocessed foods that have to be prepared. So the nutritious food basket is considered a very modest estimate of food costs. In 2022, the monthly cost of eating well for a family of 4 in our health unit district was $1,125. But another really important aspect to highlight in this work is that neither Canada's Food Guide or the Nutritious Food Basket are inclusive for all religious and cultural groups, and neither acknowledge the traditional Indigenous foods and food procurement practices. So we recognize this as a significant limitation of the Nutritious Food Basket data collection and reporting. Also in 2023, we're going to be working toward more meaningfully reporting on this in a way that extends just beyond the income focus of food insecurity, and that extends beyond the emphasis on Canada's Food Guide to be more culturally representative. So just want to bring attention to that as well. So how does 2022 compare to past years? Public health units across Ontario did not collect nutritious food basket data during the pandemic. During this time, the Nutritious Food Basket was revised to reflect the 2019 Canada's Food Guide. So as a result, data from 2022 can't be directly compared to past years. That said, it's very clear that food costs have increased, are, and continue to be increasing. Anybody doing any grocery shopping lately could identify that clearly. It's also been confirmed repeatedly in recent months by Statistics Canada that we are experiencing record high inflation rates that we haven't seen since the early 1980s, and those inflation rates are persisting now in 2023 as well. So everyone feels the pinch of rising food costs, but it's low-income households who really can't afford to pay the difference. The food costs on their own don't mean much without the context of household income. So we take the cost of eating well and combined with local rent rates, we subtract that from household income scenarios to understand if food is affordable. Health units are required to monitor food affordability within the Ontario Public Health Standards. So I want to highlight 2 key scenarios for you, both of which are included in the new Monitoring Food Affordability report, which is now posted on our website. The focal point of our reporting this year is on the scenarios for households receiving social assistance because their financial situation is very dire. The first example here shows that for a single man receiving Ontario Works, he doesn't even have enough money to cover rent and food, let alone the other costs of living. So living in this extreme poverty would be incredibly difficult day to day when the expectation is to become job ready, which is a key focal point of getting off Ontario Works for the program. And if we look at a case of a single parent with 2 children, while the income appears higher because households with children do receive more benefits associated with having children, it's likely not enough to make ends meet, and their financial situation would still be very stressful. And in the notes here, we indicate that, knowing that 1 in 5 children in Ontario live in a food insecure household, this suggests that current benefits that are received aren't enough to be protective against food insecurity. So when we think about responses to food security, community food-based programs often come to mind. These programs provide important community services, certainly, particularly emergency food programs that provide service to those in immediate need. But it's really important that we don't focus our efforts there, particularly in public health, because they don't address the root of the problem, which is poverty. And as a result, they don't reduce food insecurity. And I'd like to show you some data more specifically about food banks, because only a small minority of people who are food insecure actually use food banks. So again, if we focus our efforts here, we're missing the remaining majority of people who don't access these programs. Plus, those who use food banks are not deemed food secure. They're not, because they only receive a small amount of food items if they do make a food bank visit. So evidence continues to show that these programs are ineffective. We also know that households who struggle to pay for food also struggle to pay for the other costs of living. The compromises that they have to make include food, but extend way beyond food-related decisions. And they spend less on the other costs of living as well, such as housing and transportation, than food-secure households. So it really speaks to the larger poverty issue. Because income greatly impacts many aspects of health, including food security, income-based programs implemented by governments are considered population health interventions because they impact the health of the whole population by providing financial support to cover the basic costs of living like food and shelter. And trust me, I never would have thought that my career as a dietitian would have led me to studying income policy in Canada. But to promote Canada's food guide and the best practices around eating well, people need enough money to buy food. And so now it's an important part of our work in public health to help others understand this connection and the impact of food on health in general, and in this case, food insecurity. As a concrete example, in recent years, when Newfoundland and Labrador strengthened income policy related to social assistance rates, food insecurity rates dropped by half. So here in Ontario, having social assistance as your main source of household income puts recipients at incredibly great risk of being food insecure, and it's a public health issue we need to be drawing attention to. So I know that was a lot of information, and I'm really excited to hear some questions and comments from the group if there are any. But in summary, I'd like you to take home the key points of that both the magnitude of the problem of food insecurity, along with the severe health consequences associated with this issue, make it a really, really pressing public health problem. And we need to see income-based policy solutions to see a meaningful reduction of food insecurity on a population level. And just to bring your attention again to the resolutions that we are asking you to pass a motion on today, that were included in the briefing note, just specifically that the board continues to support the efforts of staff and stakeholders to raise awareness about and work to reduce health inequities, including food insecurity. And specifically that we call on the province of Ontario to legislate targets for the reduction of food insecurity as part of the Ontario Poverty Reduction Strategy, as well as increasing social assistance rates to reflect the current cost of living, and specifically index Ontario Works rates to inflation going forward. ODSP was indexed to inflation as of the fall of 2022, but there's been no action in this way for Ontario Works at this point. So that concludes my presentation. I went almost 2 minutes over time. I apologize, but I'd be happy to take some questions.
Thank you very much, Erin. I see the first hand up is Mary Ann, and then Jamie Him.
Hi, Erin.
Go ahead, Mary Ann.
When you talk about 1 in 6 for the province of Ontario, or right, I would venture a guess that probably in our districts it's much lower, right? Like
No,
would-
no, I wouldn't say it's lower. Sorry to interrupt. Was there a second part to your question, Marianne?
No.
Okay. Thanks for the question about data. And I guess the short answer is we utilize nationally collected data that then is provided to the provinces in terms of what we know about the issue. And we recently received some local level data just in the last few weeks that we haven't been able to sort of take a closer look at yet and put into a report. At first glance, the numbers look comparable around that 1 in 6 household rate. What we know also is that this is likely an underrepresentation of the problem just because of the nature of trying to reach people to complete population level surveys. And so I'll be interested to report back if there's something notable, like we can include that in a Board of Health update in future, because the other piece too is taking a closer look at if there's pockets of, individual, like types of groups that are more vulnerable. For example, lone parent households have been shown to be more vulnerable. Also people that rent rather than own their homes. And so it'll be interesting to take a look locally to see if there's any further information we can glean, but at a minimum, we'll be able to, in the next couple of months, show sort of like what the local picture is, but we suspect it's about on par with what the province is reporting.
Okay, thank you. No, I look forward to that information.
Okay,
Thank you.
thanks.
Okay, thank you. The next one I have is Jamie McGarvey.
Thanks, Mr. Chair. I like your numbers that you had there. I mean, for Ontario Works, like for the amount that they get is pretty good, but the amount for rent, I think far exceeds what the $650. I even looked just locally here, and we're closer to 1,000 for a bachelor apartment, which really puts it quite a bit over the top. And even a 2-bedroom apartment, you're $1,200-$1,400. And that's a very modest place. So I think a little more research on that, because I think the province needs to hear the numbers as to what's out there and get an actual picture as to what the different areas are dealing with regard to rent, and the fact that ODSP and Ontario Works is just not cutting it. Maybe there's incentives that they could provide as well. We've talked about this at the DSAB as well. The government needs to recognize that people should be working, or hopefully can work. And if so, don't penalize them because they are working, because the cost of living is so much higher right now. And there just needs to be a lot of consideration, because 700 and whatever it is a month on Ontario Works is not a lot of money.
Yeah, really, really good points, Jamie. And what I will say is that we do acknowledge that it's definitely an underrepresented number, but we do pull that data from the Canadian Mortgage and Housing Corporation. So it's sort of like we have that as sort of the go-to in terms of what the averages are being reported on for our area. But we do put that in as a caveat in the report that based on what is known anecdotally about the cost of rent in our area, we know that this likely underrepresents what rent rates are locally. But even then, it still paints such a dire picture for folks. And I guess another piece I didn't include is that if you are not housed, you don't receive the shelter allowance benefit as part of the Ontario Works, right? So you have to prove that you're housed to get that. So there's all sorts of little nuances that sort of need to be looked at. That there are income advocacy groups in Ontario providing that very, very specific feedback to the province. But whether or not we'll see action on it, I hope we do, because the situation is becoming more and more dire each year.
Yeah, I just, if you can, reach out to maybe the DSAB here in Parry Sound District and the one up in North Bay, and just have a conversation with them with regard to what they're seeing with regard to rent rates and, you know, how people are surviving on ODSP or Ontario Works. I think it'd be a good conversation, and it doesn't hurt to, you know, put those things into something that we're going to send to the government, whether it's maybe not in a resolution, but maybe in documentation that might follow with the resolution. Thanks.
It's a great suggestion. I am providing a presentation to the Nipissing DSAB next month on this issue, but perhaps I can reach, maybe we can connect and I can make that connection with the Parry Sound group as well.
Thank you, Jamie. Great answer, Aaron. Next, we have Morris, and then we have Sarah.
Thanks, Chair. Through you to Aaron. Thanks so much for your presentation, Aaron. Just a comment or so before I have a couple of questions. In a country with as much wealth as this one, no child should ever be hungry. There's no excuse for that. And while everybody's delighted that the inflation rate apparently was 5.9%, I think in January, the last month, that food inflation's on the way up. It's 8.2%. So a couple of questions. The $1,125 a month for a family of 4 in this district, I'm interested how that compares in other areas of the province. And the stats about 1 in 6 households facing food insecurity and 1 in 5 children, has that been broken down into those 3 areas: marginal, moderate, and severe?
I would have to check on that for you, Morris, and certainly if it's not broken down at the provincial level, it would be broken down at the national level. We rely really heavily on an organization based out of the University of Toronto called Proof for the data analysis and manipulation of different correlations associated with food insecurity. So I can check into that. I don't have that information at my fingertips. And sorry, remind me of the first part of your question?
The $1,125 a month for a family of 4 in this district.
Yeah. And so it's pretty, I don't have that data handy, nor do we have sort of a map of the province that shows sort of what every area, the cost of eating well is for each area. The other piece too is that although we do use a fairly consistent methodology across the province, it's also not a perfect science. So we do discourage direct comparison. So like, for example, we wouldn't directly compare with Sudbury or to the north Temiskaming or to the south Simcoe Muskoka. But the general idea is sort of looking at food affordability. And so the key message province-wide, it's the same. So, you know, households living with low income, we know they don't have enough money to make ends meet, and it's an income problem. So regardless of what the final numbers are, if, you know, certain districts are a little bit higher, a little bit lower, the key messaging remains the same. Typically, the food costs in Northern Ontario are higher, of course, because of transportation. And typically we'll see the highest in usually Thunder Bay and Northwestern. Yeah.
Thank you, Aaron. You got a question now, Morris, right? You have a question now?
That was it.
That was it?
She answered.
Okay.
Yeah, thanks, Aaron. Thank you.
Thank you.
Next is Sarah.
Hi, I'm just wondering if this was a new problem, if this is something that's crept up recently because of inflation, or if we've been dealing with this and we just haven't recognized it for a long time.
It's definitely an ongoing problem, and we've been collecting very strong national data on food insecurity in Canada since 2005, and over time we've seen now the federal government has included an indicator in their federal poverty reduction strategy around food insecurity. So we're seeing the measurement of it even better, which is great, but it's showing higher rates than it was previously showing because of they've moved around where the information is being collected from. It's through a different survey now. So, and we always suspected it was the problem was underrepresented, like I said, just because of the nature of reaching people to try to complete surveys. So I would say, and sometimes I do feel like a bit of a broken record, Sarah, because I've done, Dr. Cherko knows, I've done a similar presentation numerous times to the Board of Health, and we have been vocal on this issue in the past. We typically get really great media uptake on this, sharing our key messaging, and we always have an ask of the province of Ontario. In the past, I think we're very successful as the health community in Ontario with our advocacy related to basic income, that under the former government, we saw the basic income pilot project come forward, and unfortunately that's no longer. So there is sort of that, we have to go with what the political climate is like and where sort of the trends are. Previously, one of the pieces we've called for is a social assistance research commission, which was brought forward as a private member's bill, basically, which would be like an advisory committee to the government on having a strong provincial social assistance system, and that we've seen no action on that. So, our hands are tied. We can only do so much, but we need to stay vocal on the issue because the health community, we are a very strong voice in this work when we connect like income and health. Thanks for the question.
Thank you so much. I know Dr. Cherko was going to say a word, but you just have to watch question period on our federal government on a daily basis. This comes up. The seniors, the young children, the underprivileged, they just can't cope with it anymore. So something's got to be done. Got to be done soon. Dr. Cherko.
Yes, thank you very much, Aaron. Actually, what I was going to raise was the advocacy that we've done in the past as far as guaranteed income for households, which would certainly help reduce a lot of in my opinion, a lot of the bureaucracy, a lot of the hoops that people have to jump through, and the things that you mentioned about, well, if you don't qualify for this or if you qualify for that, and make it a simplified approach to it. And certainly we keep trying to get that message to the government, certainly that it needs to be done. And, they are doing work with poverty reduction, absolutely. But the need is even greater now, I think, than what it was when, we certainly first started with this. And we've seen the rates just continually increase and increase. And the subsidies certainly aren't keeping up to that. So, you've raised some great points. I know it's a very complicated issue. There's no easy solution to it. But the more that there is advocacy for it, and I certainly want to underscore the fact that municipalities certainly do have a great say in things in the ear of the government and through AMO, and I think that advocacy certainly needs to be worked on too, that they will listen to you. So thanks so much, Aaron, for all the great points.
I believe Morris has one more question. Thank you, Dr. Cherko.
Thanks again, Aaron. I just want to say you're not a broken record. You're a long playing record.
I like that better. No. Thank you.
No, and I agree with what Dr. Cherko just said also. And the municipalities have to step up here too. Like I know there's a motion going to get passed. It's going to go to the municipalities. And I'm sure in greater numbers, something will come out of this. It has to come out of it because this is just getting a little crazy out there.
Yeah, and you really have to look at and Aaron, you made an excellent point about the health effects. And if you look at the cost to the healthcare system alone, and I mean, front and center has got to be the suffering first and foremost. But when, from a business model, when you look at the cost from that could be, significantly reduced by putting it to where, again, when we're looking for solutions to healthcare problems, 70% lies outside of healthcare, and it's in the social determinants of health, which is exactly what Aaron is passionate about and we're talking about. And with the health unit and our healthy living team and all the teams, that's what we're looking at too. So advocacy on that scale for the social determinants of health, the basic income, food, shelter, all those things contribute so much to the health of people and a reduction in healthcare costs, which is the major consumption of our tax dollars.
Very well put, Dr. Jericho. Thank you very much, Aaron. Unless you have something else to say, thank you so much. It was a great presentation. I know a lot of work went into it, and hopefully we'll follow up and we'll mostly pass this motion for sure. Any other questions for Aaron? I see none. Thank you again. So, oh, sorry, I just saw Mary Ann's hand come up there.
I was just going to say thank you, Aaron. A few years ago, when a similar presentation was done, we were given posters that had that little saying on 1 in 6 and 1 in 5, and I put them up all over town, and people actually stopped and actually read it, and there was an increase in donations at the food bank and at the local grocery store. So I wonder, just a thought, if there was anything like that in the works that maybe we could help promote it. The government is one thing, but everyone else has, you want to share that information around as well.
Oh, thanks so much for that feedback, Marianne. This year we chose to do a highly visual report. So if you click on our website and kind of scroll through on a smartphone, the key messaging is very clear and very apparent. So we didn't do a poster this year, but that's really helpful feedback. And actually, I was surprised where even in North Bay at schools and in different places, I would see those posters up, which I thought was great. Something we can revisit maybe for 2023 reporting.
Thank you.
Thanks. Thanks so much, everybody.
Thank you, Mary Ann, and thank you, Aaron. All right, no other questions. We'll move on to 4.0, conflict of interest declarations. If there is something that comes up, I don't see anything right now, but if something comes up, please let me know. 5.0, approval of the previous minutes. Need a mover and a seconder.
Karen Cook will move.
Moved by Karen Cook, second by Jamie McGarvey. We're going to have a recorded vote unless there's no omissions or anything. Thank you. Karen Cook?
Yes.
Rick Champagne? Yes. Blair Flower?
Yes.
Oh, yes, thank you. Gary Gunther?
Yes.
Sarah Inch?
Yes.
Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Mary Ann Sticklin?
Yes.
Morris Switzer?
Yes.
Carried. Date of the next meeting. I believe. Oh, sorry. Date of the next meeting for April 26, 2023. We need a mover for that? No, thank you. Business arising, 7.0. Don't see anything. Committee report, 9.0. Oh, sorry, Doctor. I always forget you every week, so far. Report of the medical officer. This is the most important person here.
Oh, no, I don't think so.
The floor is yours, Dr. Jericho.
Thank you very much, Rick. So we've pre-circulated the MOH report and tried to highlight for you what's going on in the health unit, what work we're doing to keep you current. And I'm not obviously going to go through everything, but just touch on a few points as far as COVID update. while the province and all the industries in the province were going down over the last couple of weeks, we started to see some slight increase, certainly with active cases and hospitalizations as well. Currently, as of today, there were 23 people in hospital with COVID, but only 8 due to COVID, and no deaths have been reported. We've got 2 COVID outbreaks in congregate care settings and 1 non-COVID related outbreak as well. So again, things are just, status quo, so to speak, with a little bit of increase. And with our immunizations as well, they have certainly trailed off. And we're waiting for the NACI statement, which is the National Advisory Committee on Immunizations, to come out with their recommendations for immunizations, booster doses, and that should be, we anticipate in March or the spring to come out, and that will guide the provincial response for sure. The only other topical thing that I want to mention was about Health Canada has come out with an objective value for PFAS, which is the peripheral alkyl substances that we reported on and been dealing with for the last 7 years, that is in the drinking water system. And so I've highlighted that and given you a little bit of a refresher on it. So if there's any questions, Dr. Simblai, sorry, do you have anything that you want to add?
No, nothing. Thanks, Dr. Chipper.
Any questions? Be happy to see if I can answer them for you or find somebody to.
Any questions? Go ahead, Morris.
Doctor, just the report, I guess a few weeks ago now, about the safe levels of alcohol consumption, and I understand that the levels of alcohol consumption in Northern Ontario, as well as smoking, are higher than in other parts of the province. Any?
That's correct.
Yeah.
When you look at Northern Ontario certainly is different, and you can see it in a lot of the demographics that we have in the north, starting with income, jobs, as well as health. I mean, there's indices that are poor health. We just saw about income and related. So, yeah, with the alcohol, the smoking rates are a little higher, alcohol higher, and the health effects and poor health in the north. So, yeah, we certainly have challenges that need to be addressed in that.
Thank you, Morris. Any other questions for Dr. Cherico? No. We'll move on to 9.0. I'll need a mover and a seconder before I read the motion, or should I read the motion first here?
Yeah, you can, whichever way you want to do it.
Okay. Whereas the North Bay Parry Sound District Health Unit Annual Service Plan must submit to the Ministry of Health by April 1st, 2023. Therefore, it is resolved that the recommendation of the Financing Committee, Property Committee at the Board of Health approve the submission of the following requests for one-time funding for 2023 to the Ministry of Health by April 1st, 2023. One-time funding, Public Health Inspector, $13,500, Needle Exchange Program, $20,000, COVID-19 General Program, $185,000, COVID Vaccine Program, $1,070,000, for a total of $1,288,500. I need a mover and a seconder. Got Jamie Restool.
Blair Flowers.
And Blair Flowers. Thank you. Any amendments to the motion? If I see none, I'm going to ask for a recorded vote. Karen Cook.
Yes.
Rick Champagne, yes. Blair Flower,
Yes.
Gary Gunther,
Yes.
Sarah Inch,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Marianne Stickland,
Yes.
Morris Switzer.
Yes.
Motion carried. We'll move on now to correspondence. Everybody's had an opportunity to look at it, and nobody's got something to bring back. I didn't see any emails. I don't see any hands up. Okay. 11.0, new business. Nutritious food basket. I'll read the motion. It's quite long. I'll drink of water first.
Or you could just do the whereases.
Okay. They're all whereases. Okay. Therefore, it be resolved that the Board of Health of North Bay Parry Sound Health Unit continue to support the efforts of the staff and community stakeholders to raise awareness about and work to reduce health inequities, including food insecurities, and furthermore, it is resolved that the Board of Health call the Province of Ontario to legislate targets for the reduction of food insecurity as part of the Ontario Poverty Reduction Strategic. And furthermore, to resolve that the Board of Health call the Province of Ontario to increase social assistance rates to reflect the cost of living and Index of Ontario Works rates to inflation going forward, and further resolve that the Board of Health provide correspondence and these resolutions to the district municipalities, Ontario Boards of Health, Vic Fideli MPP, Graydon Smith MPP Parry Sound, you just got lost here. John Van Thorp, MPP Temiskaming Cochrane, the Honourable Doug Ford, Premier, the Honourable Marilee Fullerton, Ministry of Children, Community and Social Services, the Honourable Sylvia Jones, Minister of Health, and Associate Local Public Health Agencies, Alpha. I need a mover and a seconder. See Marianne, and second by Jamie McLeod. McGarvey, sorry. And do you want anything else added to the motion? If not, I'm going to call for a vote.
Can I?
Go ahead, Morris.
Through you, Chair, to Dr. Chirko, is it muddying the waters by this government dropped experiments into the living wage concept? As I understand it, there were several communities that were involved in pilot projects. Does it? I don't want to make this motion more complex than it should be, but you know, is it worth adding that in as opposed to just increasing? You know, ODSP and others that can really give consideration to a living wage.
Yeah, I don't think that there's any harm in amending it to I think that's great advocacy as well. Whether or not they, you know, they have, you know, come out and said that they're not in favor of it, but certainly I would be certainly in favor of adding it too. I think it's a very good point. Yeah. If the rest of the board is in agreement to add, if you want to come up with some wording that you would feel appropriate to impress upon them a guaranteed living wage to meet the basic standard,
Or resume the pilot.
Pardon?
Or resume the pilot.
Or resume the pilot.
Well, if we add to the motion and further, you know, we urge the province of Ontario to resume investigating the feasibility of creating guaranteed living wage in the province.
Yeah, that's very good.
Okay, I'll note that amendment.
Yeah.
Just a question.
Just 1 second.
Okay.
To resume investigating the
feasibility of
of the,
creating a guaranteed living wage in Ontario, in the province.
perfect.
Do you want to read it back, Cher? Or you? Are you good with that?
Yeah, thank you.
Okay, good.
Just a question to you, Dr. Chair. Was there a reason that we don't send it to our Member of Parliament, Mr. Anthony Rota? Or is there a reason it shouldn't go to him?
No, pardon?
Federal?
Well, it is federal.
It is federal. It's just, the money comes from feds to the province, and that's where
Yes.
the fight comes on, and the people are stuck in the middle.
You could add that.
Yeah.
Yes. Thanks for raising that.
Yeah. I have no problem
Yeah.
bringing it to him.
No,
Mr. Chair, we
Go
could
ahead,
also
Jamie.
we could also include Scott Aitchison.
Mhm.
He's the MP for Parry Sound Muskoka as well. And I think we should also copy FCM and AMO on that as well.
AMO, and sorry, Jamie, what was?
FCM?
Or AMO? FDM?
FCM,
What's that?
Federation of Canadian Municipalities as well. Cover all our bases.
Sure.
No, that's not a problem. Any other amendments? I see none. Carried. Thank you for the amendments. In camera, there isn't at this time, I believe. No, okay. And again, adjournment coming up. And thank you for everybody tonight. These are great questions. And I see that even talking to Aaron today, that there's a big problem out there. And we don't just have to talk to the people and let them know. They already know. They know at the end of the month when there's no money left. And again, there's only so much we can do, but fighting with power, which is the municipalities, can get something done.
Yeah.
Any other, I guess that's it. No other new business. I thank everybody for coming out tonight, and meeting's adjourned.
Thank you so much.
Thank you so much, everybody, for coming.
Everyone.
Good night.
Thank you. Good night.
Everyone, good night.